Instrument-assisted soft tissue mobilization is a myofascial tissue treatment option that is most commonly used by professionals such as physical therapists and chiropractors. Using a stainless steel tool with beveled edges and various contours, these tools are used to help decrease fascial restrictions, scar tissue, as well as improve circulation to help with healing and pain. They may also in return help decrease fibrosis and restriction, which can in part improve lymphatic flow to help decrease swelling. My name is Kelly and I am a physical therapist and I specialize in lymphedema, oncology, and women's health. And in this video, I'm going to discuss what instrument-assisted soft tissue mobilization is, how it's used, and how it may help decrease tissue adhesions or scar tissue after a surgery or with fibrosis for lymphatic health. Instrument-assisted soft tissue mobilization is used for pain, tendinitis, sprains or strains, for healing after a surgery, or even myofascial restriction and pain. If used correctly, it may also help improve lymphatic drainage due to the decrease in that tissue congestion or fibrosis. In order for a professional to utilize these tools, they must be certified. I am certified by 𝐏𝐫𝐽𝐬, but the other most common certification is by Graston. So first and foremost, we need to talk about safety. These tools should definitely not be used over a site that has any open wounds, unhealed fractures, thrombophlebitis, osteomyelitis, uncontrolled hypertension, hematomas, or others. Other areas that I would likely avoid over or monitor very closely would be sites of cancer, if someone's on an anticoagulant medication or a blood thinner, with varicose veins, kidney dysfunction, pregnancy, or other inflammatory or arthritis conditions that may lead to hypersensitivity or discomfort. Instrument-assisted soft tissue mobilization creates a local and acute inflammatory response due to the microtrauma to the affected area. The thought is that these tools can then help decrease the swelling and edema because if we decrease the fibrosis and the adhesions, the fluid could then move more freely out of the area. For the patient, they may find that they have less pain, more range of motion or improved tissue length, and may even find that they have more muscle strength or muscle function. So for therapists, and specifically lymphedema therapists, when we're thinking about decreasing the swelling with lymphatic drainage, we typically use our hand for manual lymph drainage. These tools are nice because they can take a lot of pressure off your hand if you are working with MLD but want to work more into that fibrotic tissue. When someone has an issue and you're using the tools, this will cause a vibration over the area, and that allows the clinician or the professional to feel where the tissue restriction is and how intense it is during their treatment sessions. So if the clinician feels that the instrument-assisted soft tissue mobilization tool is appropriate based on the evaluation and the exam, then they'll follow 6 other steps. First, they're going to assess the area that's going to be worked on, feel the tissue, have an idea of what's restricted, and what type of tool they want to use. Before doing anything else though, they're going to review the contraindications and safety precautions, making sure that using these tools is safe to use on their patients. If they feel that it is safe to move forward, then the first thing I want to do is make sure that the tissue that they're working with is warm. So either putting a patient on a bike or a cycle ergometer, whatever is going to be used to help warm up the tissue in a functional way. Spending about 10 to 15 minutes on an area to get it as warm as possible is going to make the intervention more effective. I personally use the tools about 2 minutes in an area. We use the tools at the angle with the beveled edge to get the most benefit. The clinicians that are certified know that there are multiple different tools and that each tool does something different for various parts of the body. That education will help them pick what tool is best for their patients and that specific area. As a lymphedema physical therapist, when I'm thinking about trying to decrease the swelling, I'm always looking at where that fibrosis is, where that thickened tissue is, where those adhesions are. My goal is to focus on decreasing the fibrosis and the restriction, and then I'll go back and do the manual lymphatic drainage of the area to get the fluid moving out. So for example, the most common area that I see that has a lot of restriction is either the back of the thigh or back of the lower leg. These areas just tend to hold a lot of fluid during the day, which causes a lot of pooling in the area and that thickens the area. So I'll spend a few minutes on the back of the thigh or the back of the lower leg with the tool to help soften the fibrosis. And then I'll go back and do my manual lymphatic drainage after, working in the direction of the lymphatic vessels towards the lymph nodes. After we've done our treatment, I'll also follow up with stretching. So for that example, we'll focus on stretching out the hamstrings, as well as stretching out the calf muscles. Some clinicians will even do the treatment during the stretching to help put the tissue at different lengths. This can also be done during functional movements if appropriate. After the treatment and the stretching, then we'll follow up with the strengthening program, working on different exercises to help strengthen the muscles that we just worked on. That will be most beneficial for the muscle to function in the way that it's supposed to. After we've done the strengthening, then we'll follow up with icing as needed for 10 to 15 minutes to help decrease any inflammatory response from there. Now, other clinicians and professionals are going to have different ways of using the instrument-assisted soft tissue mobilization, but as a lymphedema therapist, that's how I would include it into my treatment sessions. Some clinicians will even use these tools to help move the fluid itself. It is just another tool for the toolbox for clinicians if they are certified to help decrease the strain on the hands and get the most benefit with treatment for their patients. If instrument-assisted soft tissue mobilization is something that you're interested in, always be sure to follow up with your doctor or a physical therapist in your area who may be certified for more information to see if it is safe and effective for you. For more videos on lymphedema, oncology, and women's health physical therapy, be sure to subscribe down below for weekly new videos. And if you found this video helpful, please press the like button. I'll see you all next week for another video. Thanks, everyone.